The COVID-19 outbreak that emerged from Wuhan, China, had spread rapidly and caused a global pandemic. The virus, known as SARS-CoV-2, led to common symptoms like fever, cough, and fatigue. It is highly contagious through droplets, aerosols, and contaminated surfaces and can even be transmitted by asymptomatic individuals. Severe cases can result in pneumonia, respiratory failure, and death. Thus, supportive care is the main treatment approach. The global response to the pandemic has involved the development of vaccines, with numerous candidates reaching clinical trials. Apart from vaccines, artificial intelligence (AI) has also played a crucial role in tackling the crisis, aiding in diagnosis, treatment prediction, drug development, resource management, and more. Machine learning (ML), especially in medical imaging, has been instrumental in analyzing clinical data and identifying patterns for diagnosing and predicting the disease. Several literature reviews have explored the use of AI and ML in addressing COVID-19. Some noteworthy AI or ML models include convolutional neural networks, CNN, which have been commonly used to diagnose COVID-19 from X-ray exams, while other models like ResNet and logistic regression (LR) have been employed for classification and prediction. This systematic review focuses on AI applications prior to vaccine distribution, specifically considering imaging, laboratory, and clinical data. This review provides valuable insights to the most frequently used AI techniques and their corresponding data types. It also discusses the limitations of the study and concludes by highlighting observations about the adoption of AI techniques and challenges faced in this context.
Now let's examine the methodology of a systematic review that focuses on investigating the utilization of artificial intelligence (AI) approaches for diagnosing or evaluating patients with COVID-19. Since there was no vaccine available at the start of the pandemic, the researchers conducted a research across 5 electronic databases from December 2019 to October 2020. Initially, a total of 839 papers were collected for analysis. To do so, a systematic literature review (SLR) was used where we choose, evaluate, and describe the material that is relevant to a particular research project according to PRISMA guidelines. The first procedure for SLR is eligibility criteria. It includes the identification of the targeted studies. In this case, we include the studies that use AI approaches for the diagnosis or outcome of patients with COVID-19, either by imaging or clinical data, and studies that support or assess methods and classification models for the diagnosis or prognosis of COVID-19 patients. To exclude unrelated studies, inclusion and exclusion criteria were used. It includes studies that were established between 2019 and October 2020, written in English, available in complete format, and published in a scientific format, while excluding any unrelated information or insufficient details of studies as listed in the slides. Next, there are 5 electronic databases were used and proceeded with a search strategy to select and analyze the most relevant articles. In this strategy, information was carried out according to keyword and synonym search such as AI, machine learning, deep learning, and COVID-19. And for the selected keywords, Boolean operators were used as shown in the picture. Next, we remove the duplicate references using Mendeley software. Third, there are 2 phases for selection steps, which are Phase 1 and Phase 2. For Phase 1, there are 6 researchers reviewed all papers found in the electronic databases, reviewed the titles and abstracts, and choose the ones that appeared to fit the inclusion criteria, while for Phase 2, the same researchers were split up to read all of these chosen studies while rejecting any that did not fit the inclusion criteria. If there is any disagreement, it will be resolved through discussion and consensus with all researchers or involve a third researcher to evaluate the article in order to reach a conclusion. So this is how the papers were filtered. After excluding any unrelated, repeated, or insufficient data, there are only 64 studies that are finally selected in the systematic review. Next, study characteristics will be conducted to evaluate the papers that we assess. A summary table was created consisting of bibliographic reference, data type, AI method, performed diagnostic or outcome, and references. Additionally, Sankey diagram and word cloud are also used. To summarize, the majority of the selected papers reached diagnosis purposes. The most data type we used was chest CT scans and chest X-rays, while the most AI method used are convolutional neural networks, CNN, and residual network ResNet, which involve image examination. Thus, we can conclude that most of the work involve image examinations. CNN is particularly a deep learning network architecture that learns directly from data. Its primary strength lies in its ability to identify patterns in images, enabling object recognition and classification of various classes and categories. It can be highly effective in classifying audio, time series, and signal data, while residual network is a deep learning model primarily utilized in computer vision applications.
Going to continue with the third subtopic of this paper, which is the discussion part. The first part of the discussion is the image paper. This review article highlighted that mostly machine learning in COVID-19 articles propose a model that are subdivided into two classes or three classes. For two classes, it is subdivided into COVID-19 or non-COVID-19, while three classes of division, it divides into COVID-19, common pneumonia or non-pneumonia. Nevertheless, few researchers also include other respiratory disease like bacterial pneumonia, tuberculosis, H1N1, and influenza. Moreover, some researchers also include disease progression in few articles. Next, the second subtopic of discussion part is clinical and laboratory papers. For clinical data, demographic, symptoms, and sign, and also history of the disease is one of the clinical data consideration. From the image you can see here, it shows of contribution of factor in the machine learning. The highest contribution of factor is age, followed by gender, fever, diarrhea, cardiovascular diseases, cough, diabetes, pulmonary disease, kidney disease, smoking, myalgia, and oxygen concentration. For the laboratory data, this image summarized the frequency laboratory tests used. This review article summarized that C-reactive protein test is commonly used in the laboratory for COVID-19 patients, where 80% of the papers mention about C-reactive protein. It is followed by white cell count, where 50% of papers mention D-dimer assessment, which is about 30%, and lastly, 20% of papers mention about urea, lactate dehydrogenase, and procalcitonin. The last subtopic for the discussion part is about the correlation of clinical, laboratory, and image paper. This article highlighted that four factors of laboratory, clinical, and imaging data that were associated with the outcomes are the age, white blood cell count, pro-reactive protein, and chest CT. However, on the other side, there are different clinical data across multiple articles which are the gender, chest pain, cough, and diarrhea, while different laboratory data is about the transaminase and the cardiac enzyme. Moreover, this review article also mentioned 5 software that has been used to extract information from the image, which are ResNet, CNN, VGG, UNet, and EfficientNet.
For the result, out of 839 initially found papers, only 24% met the eligibility criteria, resulting in a final selection of 64 papers, which accounts for 8% of the total. Besides, majority of the selected papers, which is 79.7%, centered around using machine learning for diagnostic purposes, indicating the importance of automated diagnosis in medical research. Next, only 18.8% of the papers addressed outcome prediction, indicating a smaller focus on predicting patient outcomes using machine learning techniques. Other than that, several noteworthy techniques utilized in the papers included ResNet 15.6%, CNN 14.1%, VGG 10.9%, LR 9.4%, UNet 9.4%, DenseNet 6.3%, and EfficientNet 6.3%. Apart from that, a small percentage of papers, which is 7.8%, utilized multiple machine learning techniques such as ResNet, CNN, VGG, DenseNet, and LSTM. demonstrating the combination of different models to achieve better results. Besides that, LR, a statistical model, was used in 9% of the papers, primarily for analyzing structured data. The results also showed that the reviewed papers incorporated various data types, including CT and X-ray images, clinical, laboratory, and structured data. Deep learning algorithms, especially those tailored for image analysis, were widely employed in the papers, emphasizing their effectiveness in medical research. Next, majority of the papers focused on using machine learning for diagnosis, indicating the importance of automated diagnostic systems in medical applications. Lastly, there are few papers address outcome prediction, suggesting a lesser emphasis on predicting patient outcomes using machine learning techniques. Overall, the systematic technique identified the prevalent use of specific machine learning techniques, predominantly for diagnostic purposes, utilizing various data types with a particular focus on deep learning architectures for image analysis. The limitations for this paper include selection of general keywords. The review acknowledged that the chosen keywords were general terms and did not include specific names of AI and ML techniques. This could potentially limit the scope of the search and overlook relevant studies that utilize specific AI or ML techniques. The next limitation is focus on a specific time period. The review adopted a specific time frame, specifically before the distribution of vaccines. While this was done to capture the intense search for patterns related to the diagnosis and outcome of the disease, it may exclude recent studies and developments in the field. The third limitation is exclusion of non-AI or ML approaches. The review only considered papers that employed AI or ML approaches for diagnosing or predicting outcomes of COVID-19 patients. This exclusion may result in missing out on relevant studies utilizing other non-AI or ML methods that could provide valuable insights. The fourth limitation is the possible loss of relevant studies. The review acknowledged that some relevant studies might have been missed due to the specific search criteria and focus on efficient AI or ML models. It is important to recognize that not all relevant research may have been captured. The last limitation is the limitation of English language publications. The review states that it only considered works written in English. However, this may have excluded significant studies published in other languages. This limitation was highlighted in a research by Abdul Razak et al. And suggests that important findings could have been overlooked. In conclusion, this systematic review examines the role of AI in diagnosing and predicting outcomes for COVID-19. Out of 839 articles, 64 were analyzed in this review. Chest CT scans and clinical or lab data were commonly used. Besides, deep learning models face challenges due to limited data and manual image annotation, but techniques like transfer learning do show some signs of help. Besides that, accuracy rates exceeded 95%, showing that AI has the value in healthcare decision making. Explaining the model's results still remains a challenge, addressed by explainable AI. Up until this paper was published, over 1,000 AI-related COVID-19 papers were found, highlighting the need for more specific reviews considering AI or ML techniques. Apart from that, this review aims to inspire further research using AI or ML techniques with small and large databases to combat the pandemic. Previously, COVID-19 was known to be a disease that affects mainly the lungs. However, today, it is known to affect multiple organs, posing new challenges for automation. AI or ML models can also identify potential long-term COVID-19 syndrome and provide timely rehabilitation support, which provide a better scenario in healthcare. Therefore, future research can explore AI's role in diagnosing pediatric cases and predicting hospitalization duration accurately.